Hi, James.
It's a pleasure to be here, and thank you very much for the opportunity to speak to you today.
Your research found that FGMC is one of the leading causes of mortality among girls and women in countries with high prevalence in Africa. This is for sure a hidden and unreported reality. Can you share briefly what what key findings you got from this research?
Yeah, I'd be pleased to. My expertise is just as an economist and as someone who is used to trying to measure things that are hard to measure. So what we did in the research is we compared for countries in which FGM is widely practiced in sub-Saharan Africa, we got data on the percentage of how prevalent it was and at what ages. So there are countries where it is done, almost every girl is subjected to FGM, and that happens shortly after birth. And then as you know, then there are other countries where it happens at later on, and it varies often within a country. And we relate that variation to patterns in the mortality rate of girls of that age. And so what we do in a sort of statistical model is we try and get rid of all of the other things that might explain it. There may be particular events in a given year or in a given place that lead to the mortality rate being higher. So we compare the mortality rate of girls of a given age in a given year with firstly with boys of the same age in the same country in the same year. Now, the mortality rate patterns over time of boys and girls are a bit different, but then we can also take into account the overall mortality rate of girls of that age in the countries that we study. And so we do that, and then we take into account the fact that there will be some things that happen in a particular year. Perhaps there are, say, floods, which cause extra disease or something and might increase the mortality rate. So we take out all of these other things that are going on so that we can be confident that we're sort of finding the effect of FGM on the mortality rate of girls. And what we find is that, as you said, it's a leading cause of death of girls and young women. So in the countries where it's practiced, after the leading causes of death are enteric infections, respiratory infections, and malaria. And after that, our estimates suggest it's FGM. But you think about how much attention is given to combating malaria, because, and rightly so, malaria, kills a lot of people, ruins a lot of lives. But after malaria and other infections, FGM is really high. And the key difference is that this is a choice, because it implies that there's about up to 44,000 extra deaths a year, which is an enormous number. I mean, that means there's a girl every 12 minutes dying because of FGM. And so, fortunately, there are organizations like yours which are working to stop it. But I think the results suggest that governments and funders need to be doing much more.
Looking at this research of the leading cause of death, one of them is FGM. I really didn't want to believe it, because I really couldn't tell that how and what's happening really. But hearing about you, James, talking about the real statistics about mortality and how you actually looked into it, looking at the boys and the girls and the different ages and how it's really affecting women and girls, it really hit me hard. But what do you think? How can these findings be used to strengthen accountability frameworks to treat FGM not only as harmful practice, but as a public health and human rights emergency?
There are others who know much more about changing the narrative around FGMC than me, particularly activists and campaigners like you, Christine, and others. The way I see this in my sort of inexpert view is I think we already knew from previous work that FGM was associated with complications during childbirth and often great pain for the girls and young women who are subjected to it. I think where our research has hopefully helped is by emphasizing that it kills, girls with astonishing regularity, 5 every hour. And I would hope that it's easier to make the case against FGM in the same way that we make the case against other things that harm people, but children in particular.
Thank you so much, James. And of course, looking at what you've just said, that it's high time the governments looked at it not only as harmful practice, but also even give comments and timelines, even how they treat other emergencies. Thank you for these great findings. And at the same time, at a time when women's rights face significant global pushbacks and funding for gender-based violence is shrinking, how do you see evidence like yours influencing policymakers to maintain or even increase investment in ending FGMC?
Well, it is the case that getting the necessary funding to combat FGM is going to be harder than ever. There are many things that aid organizations should be funding, and in a world as unequal as ours, it's there is never going to be a shortage of good projects. Whereas I would hope that the sheer scale of the deaths associated with FGM means that even when budgets are becoming smaller, that it helps people like yourself, people at Orchid Project, and national governments make the case that actually FGM should be right at the top of the list of things that the remaining money is going to, because working to eliminate it will save so many lives.
We believe that real change is happening with young people being involved and taking lead. But most of the times you find that these youths are rarely involved in research, design, or policy-making processes. How can academic institutions create more meaningful partnership with youth activists like myself to ensure research reflects lived realities and inform impactful advocacy?
I think this is a really important point. I think the research always needs to be in collaboration. That it's not a healthy or productive idea for someone like me to sit in my office in England and just sort of look at my computer, because there's so much I don't know, and the research is not going to be as good as it could be if that's what I did. And I think a further mistake is that even when people like me have sought to collaborate with partners, there has been a focus on working with people who maybe are quite senior because that's who you get put in touch with. But it would be great to have more connection with youth activists, because I think, and I'm not a historian, but I think that youth movements throughout history all over the world have been, a powerful force for change, right? There is something particular about the power of youth activism. And this is particularly true in the countries where FGM is most widely practiced, right? Because they have lots of people of the age to be youth activists. And so if you're not talking to those people and you're not collaborating with them, then you're really missing an opportunity. Having said that, I don't think it's for me to know what youth activists might want from universities like mine, but maybe maybe you can come in and tell me what you think would be most useful.
Well, thank you so much. Some things that I would really, really advocate for is youth-led design, youth-led research designs. Probably working with networks like Anti-FGM Youth Network Kenya, and also we have other networks across the globe. I would say to be able to get the culturally relevant and youth-centered interventions or policy intervention will really help. But I also understand the University of Birmingham Institute for Global Innovation could also serve as a hub for partnerships, probably looking at which youth institutes or youth movements could partnering with the Institute of Global Innovation to ensure that more research and activists are engaged. I would also suggest a micro grant for the youth activists, especially youth groups that are actually coming up to support collaborative projects, even to ensure that this information is shared, because the less youth that are actually in the know-how of the research findings, and this would really mean a lot to us as youth advocates to ensure that we have this information and we are able to actually roll it out.
I have a lot to think about in what you said and to reflect on, but I liked in particular this idea of micro grants. It seems like to empower people to make use of the work in the way that they want to make use of it, rather than for us to try and suggest how people will make use of it.
Looking at the youth activists, also looking at the policy-informed outputs and advocacy platforms, we could think about partnering with youth activists to present these findings at national or international forums, maybe the UN panels or parliamentary sessions.
Yeah, I think that is something that we should definitely do more. Organizations like mine is finding a way to bring together the research and the lived experience, but in particular that of youth activists, and not just I think there is something when you want to make a really big societal change, like ending FGM, and I think youth activists are crucial in that.
Wow, thank you so much.